Hi, this is Samir Jamal and today we're gonna discuss the buccal nerve block. The buccal nerve is a branch of the anterior division of the mandibular nerve, which is the third cranial nerves, and consequently is not anesthetized during inferior alveolar nerve block. So we have to give a separate anesthesia for the buccal nerve. The other names for the buccal nerve include long buccal nerve or buccinator nerve block. Area anesthetized include soft tissues and periosteum, buccal to the mandibular molar teeth, buccal to the mandibular molar teeth. Indications: when buccal soft tissue anesthesia is necessary for dental procedures in the mandibular molar region. The contraindications include infection or acute inflammation. Advantage: high success rate and technically easy. Disadvantage: potential for pain if the needle contacts the periosteum during injection. Alternative techniques include buccal infiltration, go-gates, Vazirani Akinosi, periodontal ligament injection, and intraosseous. The recommended gauge is 25 or 27. The area of insertion, which is the mucous membrane, distal and buccal to the most distal molar in the arch. This is a very important point. You have to look inside the patient's mouth and seek the most distal molar tooth in the arch. The area of insertion will be distal and buccal to the most distal molar tooth in the arch. The orientation of the bevel toward the bone. You have to orient the bevel of the needle toward the bone during the injection. Failures of anesthesia is rare with the buccal nerve and may be related to the volume of the anesthetic, which may be inadequate. The complications, few of any consequence. Hematoma, which is a bluish discoloration and tissue swelling at the injection site. As shown in the picture below, this is the target of insertion of the needle, which is distal to the most distal molar in the arch and buccally. You insert about 1 millimeter of the needle inside the tissue, and the amount deposited, which is ranged from 0.2 to 0.5 ml. As shown in these pictures, the area of the insertion, which is distal and buccal to the most distal molar in the arch. The most distal molar in the arch, the target of insertion will be distally and buccally. And that's all. Thanks for watching. If you're still confused about some points, I'll try to clarify it more. Thanks for watching and don't forget to subscribe to my channel.